about Bill and myself. Or am I still, let me see if I can, there we go. So we're gonna just introduce you a little bit to AARP, talk about some of the tools and programs that we have that we think are relevant, and then talk about AARP's network of age-friendly states and communities. That's our age-friendly network. And then we'll have some questions and answers and some discussion. So I want to start with a story. This woman on the screen, her name is Ethel Percy Andrus. She's the founder of AARP. She was a high school principal, and then she worked as in this association of school principals in the state of California. She was in charge of welfare, and she learned that the retirement plan for teachers paid $40 a month, which was not enough to live on, much less to live on with dignity. And one day she received a call from a shopkeeper in a town nearby saying that a teacher was in poor health. So Dr. Andrus drove out to the address and found nobody was home. She went to the man, knocked next door, and the man next door said that the resident of that house was not elderly, was not old, and was not in need. But then he remembered that there was an old woman who lived in the back of the house. So she went back to the back of the house and she found a woman who she realized was a teacher of hers when she was a principal. She found this old woman living outside in a chicken coop, a chicken house. And the impact of that visit was so profound that she went on to found the National Teachers Retired Association, Retired Teachers Association, and then in 1958 to found AARP. And the purpose of AARP is to empower people to choose how they live as they age. So as Joanna said, we have 38 million members. We're a membership organization, but we consider ourselves a social mission organization with a 38 million membership. So our impact agenda, our social impact agenda is around these areas of health security, financial resilience, and social connections. And the area that we're going to talk about today falls under the social connections, as well as a little bit of the health area. So just a little bit of the statistics. I'm sure you've seen this kind of a map for a lot of places. Israel is not aging as much as many other global communities as quickly. The United States, basically by 2034, for the first time in the US history, we will have more people who are 65 and older than those who are 17 and younger. So we're rapidly aging. And the area that we're going to talk about today is our work in an area called Livable, we call Livable Communities, which is really all about making every place a great place to grow up and grow old. And Bill will talk a little bit about some of these areas that are described in mobility and housing options and access to healthcare and opportunities to engage in the community. We do a lot of work in all of these areas that Bill will talk about. I do want to mention we do a lot of policy advocacy work. And so we have a policy book that is updated every 2 years. And this is the section that talks about livable communities policy. So we have an office in every one of the 50 states, plus the Washington, DC, and the territories of Puerto Rico and the US Virgin Islands. And every one of those offices now does livable communities work, which includes policy advocacy. And so the policy book is very important because all of that work needs to be consistent with the organization's national policy. So I want to share some tools and some guidance that might be helpful for you all in a number of different areas where we work. This is the AARP's Livability Index. It's a free online tool, and it's only for the United States. So mention it because it could serve as a model. Essentially, it is comprised of nearly 100 sources of public data, publicly available data. And it's a way to measure how livable your community is, down to the neighborhood level, down to the census tract. And so there are two ways that it's measured. It's measured by metrics. So how does my community compare with other communities? And then it's measured by policies. So what policies have been enacted in the municipality that will improve things, around proximity or how close it is to grocery stores, parks, the diversity of destinations, different policies in all of these areas that you see on the left side, the housing, neighborhood, transportation, all of these 7 areas, which align almost directly with the domains of an age-friendly city, which Bill will talk about. So I'm going to just share a little bit about some free guidance that we've developed that I think might be of interest. And by the way, I meant to mention the Livability Index will be updated on April 18th. So it might be something you want to wait a little bit to check out. It's going to be and have a new look and feel to it. But it's been used by municipalities mainly when they're thinking about their age-friendly programs and they're identifying what are the priority areas they need to focus on. So the index has helped in that way. But it also helps individuals if they're moving and they want to see, well, how age-friendly, how livable is the community that I'm thinking of moving into. So this is one of the other publications that we have. It's called Engaging the Community to Create Community. I want to mention it because in the US, the disability community a number of years ago developed a quote that says, nothing about us without us. So the idea that the older adults should be need to be a critical part of determining what their community will look like. Those are the people who've built the community in many cases, and they should also help to determine what it looks like as they age and as our lifespan increases and there are different needs. So basically the booklet offers examples of effective strategies and programs in towns and cities throughout the United States where they're partnering with residents and community organizations and local businesses with the aim of identifying community needs and the types of programs and policies and projects that can meet those needs and improve the lives of older adults and people of all ages. So we found the municipal efforts to collaborate with residents not only generate strong results, but also build trust between city leaders and citizens. And that really encourages and sustains future engagement. Another one is the walk audit, which is one of the most popular tools because it's a way to concretely engage residents. So older adults in the US are a disproportionate percentage of pedestrian injuries and fatalities. I imagine this is the case in many places. So unfortunately, this is one of the easiest things to measure. Individuals or teams of people can go out and evaluate the safety and walkability of a street or an intersection or a whole neighborhood. And this audit toolkit provides step-by-step instructions and checklists for examining these spaces in the community. And if you do this audit, you can share the results with elected officials and with other local leaders and advocates when you're advocating for improvements in the community. This handbook for improving neighborhoods provides options for communities to consider as they're identifying even small scale or incremental policy changes in ways that can strengthen the local economy, as well as promoting equity and supporting inclusion of people of all ages and abilities. And the publication is filled with photographs of real places that show suggested solutions and actions. This one around creating parks and public spaces for all ages. Parks should belong to people of all ages, but the way they're designed and maintained, and even sometimes the programming, often doesn't reflect that purpose. We had a study in the US in 2014 found that older adults only account for 4% of total park users. So there's a worksheets and planning resources in this guide for local leaders and residents to work through the planning phases of improving public spaces and parks. And it helps to answer all kinds of questions like who is using the community's parks and spaces, and what do they do in those spaces? What are the challenges that the community's parks and spaces have? What opportunities exist for enhancing the community's parks and spaces, and what people and groups should be included in efforts to improve them. This is another one, the Home Fit Guide, which is again one of our most popular guides. It's also been translated already to Spanish, Chinese, Korean, and Vietnamese. It deals with the fact that America's housing stock does not fit this rapidly aging population. But most people, through our surveys, we know want to remain in their homes as they age. And so this is a way to do home modifications and make a home more aging friendly. Online, there's now a room by room tour. So for every type of room, the bathroom, the hallways, the bedrooms, and the guide can help, policymakers and local leaders advocate for housing options that the community needs. This is a guide that's not quite out yet. It'll be out in the next month or so. It deals with the fact that the climate crisis is causing natural disasters to increase in frequency as in severity as well. And older adults are among the most vulnerable populations. So the key is developing effective communication between local leaders and emergency providers. So we work with FEMA. FEMA is the Federal Emergency Management Agency. And essentially this document and another one like it is a collaboration between AARP and FEMA, where there are two documents. So this document is the one that's focused, it's more our document focused at leaders in the community and aging leaders to how to reduce risks and better protect older adults in disasters. And then the other document is FEMA's document to their people. We need to get these people to speak the same language. And so that's what these documents are all about. So I am with AARP's international branch. And I want to just mention, we have an award-winning publication called The Journal that comes out once a year. That this is this year's Leaders in Longevity. This focus each year is on a different part of the world. It's usually a different country. This past year, because we couldn't travel because of COVID, we did it on a region and we did Latin America. So we've previously done Singapore, the Netherlands, Japan, and we've spoken with some of our Israeli colleagues about the possibility of doing one in Israel, which would be fabulous. So this is a program that I run called Equity by Design. As I mentioned, I'm an urban planner, so I've done a lot of focused work with city planners, but also architects and developers and other professionals in the built environment, with the objective of getting them to incorporate aging considerations and equity in their ongoing work, and to also foster, again, developing a shared language across those different professions. So in 2019, in December, AARP collaborated with partners in Europe, and we convened a select group of about 20 built environment professionals. What emerged was a set of guiding principles for the built environment sector, which were basically, these are the critical areas that the group thought that need to be addressed. And so these principles have guided a series of global conversations that we've done over the last 2 years. Our webpage has 5 short, like 2 to 4 minute videos with key insights from those conversations, but also, of course, the full conversation is recorded there as well. And the Declaration of Principles is available on the website, but I'm just going to go through a few of them and give you a sense of where we're focused. So this one is about enabling design, which is a term coined by my colleague Esther Greenhouse. It talks about the idea that our built environments, including our homes, were designed essentially for the average height male between the ages of 20 and 40. And so everyone else that's outside that needs to adapt. And so if the environment is overly demanding, people struggle. And if it's under demanding, people don't have the opportunity to use their muscles and to function within their abilities. And so those can atrophy, those can weaken. And so in many cases, the built environment is disabling. So this principle focuses on improving the fit between people's needs and the environments that they live in. And then on the other side is the second principle, drive informed demand. That deals with the fact that housing really has been built for so long in the same way that people just can't even envision something different. They just envision a very narrow range of products. And so consumers don't really know what to ask for and therefore demand very little. So this is just an example. You see the Lifelong Housing Certified House. It's a program by the Rogue Valley Council of Governments in Oregon, state of Oregon. It's a voluntary certification. So people can voluntarily get their home certified at a level of how friendly it is to lifelong housing. And hopefully that can move the real estate market and get people to understand that they should demand more. This principle is about alleviating disparities, which COVID-19 has highlighted in the US, how marginalized groups of people, older adults, but also Black people and people of color, Native people and immigrants, how we've marginalized these groups. And in many cases, through physically segregating them, we've also disinvested in the places where they live. And so those communities of color often suffer by worse health disparities, but also educational, environmental, and other disparities. And so this principle is that we need to prioritize creating and maintaining these enabling built environments in disproportionately impacted communities, that is a vehicle for alleviating disparities. And again, this idea of incorporating their input, we need their input to address the problems in their communities. One of our dialogue discussants pointed out that the people closest to the problem are the people closest to the solution. But we learned that requires two actions to really engage the people. First of all, we need to build the community's capacity. So that includes teaching local members of the community the language of planning and design so that they can contribute their unique insights in a very meaningful way. And the second action that we learned you need to take is to what we call democratize data. So invest in the platforms that facilitate generation of input from data from these community members, directly from them. And of course, then ensuring that those community-derived data are actually helpful or actually used in decision-making. This one is about prioritizing connectivity. I'm going to go a little quicker now because I see that there's not a lot of time. So this is around problems with obviously limitations to broadband access by people who are lower income and digital literacy among older adults. And so we talked about that. But the other thing that we really focused in this conversation was around the idea of surveillance society and the fact that, technology and sensors are now attached to kind of every aspect of the built environment, including our own bodies. And so we're inviting virtual strangers into our homes on a mass scale. And we're doing this starting with older people. They are the guinea pigs. And so the question is, just because we can design it, does that mean it should be done? So we talked a lot about those issues and the need to create an ethical roadmap for the development and the use of technology. And, do that with building in our values as it develops, as opposed to trying to later bolt on our values. From my experience in Israel, I actually think both the technology side and the ethics side are areas where Israel can play a leadership role. So the last one I'll talk about is facilitating intergenerational engagement. So I know this group has talked about ageism, which is discrimination against a group of people just because of their age. And one cause of ageism in the US is the lack of opportunities for people to regularly and spontaneously even interact with others, to run into people across of other ages. So this principle is to create living environments that facilitate engagement across those generations. And of course, the most intergenerational environment is the home, where multiple generations live together. So multi-generational living has been on the rise in the US. It was in 1980, about 12%, 22% before the pandemic, and now is estimated to be as high as 26%. So more than one out of every 4 people lives in a multi-generational household. And one of our experts pointed out that people from societies outside the US don't understand why we decided that there's something wrong when family lives with, their generations live together. Many cultures, they don't even relate to the term multi-generational living, they just call it family. But our housing was not designed to be multi-generational. So in addition to being a good fit with people across the lifespan, it also needs to provide enough privacy and adaptability. So spaces need to be able to flex as a family's size and a family's needs expand and contract. I know from living in Israel and working in the Middle East that there are a lot more families who live multi-generationally, and that's an area that we're actually very interested in. So if there are any interesting models in Israel, we'd love to talk about those and learn from those. So the last thing I'll talk about is the Equity by Design's new series, which is called Principles in Action, because a lot of people in the built environment were saying, okay, these are your principles, these are great discussions, but show us some of what's happening. Who's moving the needle? What are the innovations? And so we create case studies and then have an event on each case study so that people can ask deeper questions from the innovator behind the innovation. So again, you can register for upcoming events, but you can also check out our case studies and the recordings of prior ones on our website. So here are a few examples. This one is Espacio Ludico in Chile. It's around public participation in planning, again, the community engagement. This is really interesting innovation because they do it all through play. So they actively engage people through games in how to make their open spaces in their communities better. And what's interesting is they say that it levels the playing field, because in a game, they say all are the same in a game. So, everybody's opinion matters the same amount. And when COVID came, they couldn't do this in person, so they had to respond and did so really creatively. They created this this game, which was 16 square blocks in different colors. It was in a box, and the 4 colors represented different characteristics of public space: social, fun, attractive, and healthy. And then a family could sit together with these blocks, and through manipulating them, building them in different ways, they could articulate their vision for the open space. And then they would take a picture and they would share the images through WhatsApp, and those were uploaded to the website and through YouTube, so the community could continue to play and to follow the process and discuss and debate everybody's ideas. Another one is this Clarion Housing Group in the UK. It's the 5th largest developer in the UK and the largest housing association there. As a result of the work, they were part of the London forum we did. They then developed an age-friendly strategy within a year after that meeting that does things like ensuring that their developments are exemplars of age-friendly homes and communities. Their age-friendly strategy wants to cultivate clear design standards and specifications for age-friendly housing. They want to ensure that residents have the right home at the right time, including making sure they know their housing options and help them anticipate changes as they age. And on that point about right home at the right time, this is a program called Ava Housing from Ireland. And they refer to it as right sizing instead of downsizing, the idea of having the option of or making your home the right size, as opposed to, oh, it's not always about downsizing. And so this program is really one of my favorites. It's a home modification program where the older person who's living in a home alone, they probably raised their kids in the home and they've finished paying off their mortgage. In the US, this is a really big problem. It might be in a lot of places where people are what we call asset rich, but cash poor. So they own their home outright, no more mortgage, but they have very little money, and they can't pay for increasing local taxes, property taxes. They have a hard time maintaining their home and fixing things. So this program, it comes to this person and says, we will help you to modify the ground floor of your home. So the ground floor is where you can age in place. And then we'll modify the second floor so that you can rent out that part of your home and have someone, so you can have some income, so you can have some company and help deal with isolation and somebody to help you with things. And a couple of interesting things about this program is, one, they found in Ireland that at a certain time after World War II, the housing was built based on a same model. So there's kind of one stance that's really popular in a lot of cities in Ireland. And so they could create 2 or 3 or 4 design sketch schemes that way nobody needed to pay for the design every time they came to this program. They could just choose one of these approved designs that had already received zoning approval. And the other interesting thing about the program is this person and the first few people they approached lived near a hospital. And so at hospitals and a lot of medical facilities, there are a lot of people who are doing a residence who are there for a year or 2 years, and then they move on. So it's an individual looking for a place to live, and that's very hard to find, a 1-bedroom apartment, and that's affordable. And so they matched them with these homeowners. And so not only does this person have a person living in their home, they have a person who has medical expertise of some kind living in their home. So this is a really, I think, a fabulous program. This is our last one that we did, Quiero mi barrio, or I Love My Neighborhood. It's an urban regeneration program from Chile. They're doing some interesting things there. It addresses both the physical infrastructure and the social fabric in a poor neighborhood. It's a collaborative model between the national government through its regional offices, like the districts in Israel, and then the local municipalities, and then the residents. The residents are integrally involved through something that they create in the neighborhood called a neighborhood development council. And it really demonstrates the broader impact of when you take the physical interventions and intersect them with social management programs. So it can really also increase the residents' ownership of their community and the spaces that they live in. So the last thing I want to mention is just our collaborations that we do globally. These are just some examples of organizations we work with. The World Health Organization has regions. And so the region in the Americas is called PAHO, the Pan American Health Organization. So we work closely with them around Latin America and the Caribbean. 2 of the projects that we're working with them on now are, one is how cross-sector collaboration is so critical to effective age-friendly community work. And that's culturally a difficult thing in Latin America, we learned, to work across sectors. So we are developing a capacity building program that's based on research we did, with the first one being academics who are working with municipalities to provide technical assistance or leadership. And then the second program we're doing with them is, age-friendly communities in the United States and a lot of other places are often an activity in middle or upper middle income communities and very rarely in lower income communities. And so we're working with PAHO and Help Age International to develop a toolkit for no cost or low cost age-friendly community interventions. That'll be out by June. And then these are some links to our shared resources that were on here. And just to mention the WHO, the World Health Organization, we work with them a lot through their global network of age-friendly cities and communities. So AARP runs the US affiliate of that group. And with that, I'm going to turn it over to my colleague, Bill, who is the manager of that program. And we'll let you take it from there.
Stephanie, first of all, thank you very much for such a wide and fascinating range of creative activities from which we can all learn and perhaps find connections and collaboration. I'm just sorry that we had to limit you to such a short time, but I'm sure this is only the beginning of a common path and partnership. So thank you very much. We have collected some questions during your presentation and we'll be addressing them after Bill's presentation. So I'm asking my colleagues to add other comments and questions in the chat. We are going to collect them and refer to them at the end of Bill's presentation. So Bill Armbruster will talk to us about age-friendly states and communities. We'll hear some examples of how communities are addressing issues that they've identified. Bill, thank you.
Great. Can you see my screen okay?
Yeah, go ahead.
Great. So again, thanks for having us here. I think Stephanie did a great job in trying to get a lot in a very short period of time. I'm going to try to talk a little bit more specifically about the network. So Livable Communities is sort of our broader umbrella of the work that we do. And then Age Friendly for us is really specific to the network. It's communities and states who've made this commitment to get involved and said, yes, we want to be part of this network. We want to go through this process. So a lot of places use Age Friendly and Livable interchangeably. When I talk age friendly, I'm going to be talking specifically about the network. And you can see here, it is a commitment by elected leadership. So you have a municipality say, yes, we want to do this because we may be involved. There may be things around housing, transportation, or the built environment that we could and should do. And then they commit to go through an initial 5-year process where they do that assessment. And that includes listening, surveying, identifying what's going on. They create a plan, then they evaluate what their plan is and implement it. It sounds very simple, but those are just the steps. And the one thing we do want to ensure here, which makes this unique, is it includes the voice of older adults throughout the process. And that is a must, because the reason we as an organization became the US affiliate, as we were talking to planners, we were talking to community leaders, and they were saying, yes, our focus is on youth and family. And we're like, well, what about older adults? Well, yeah, we have a senior center. So there really was these ageist perceptions about older adults, that they were just in nursing homes and that. And so this, again, was an opportunity for us as an organization to change that dialogue, change the culture of how we plan, how we talk, how we do things. And the exciting thing of the communities that have already gone through this process, they've all said, yes, this changed the culture of our work and we're doing it again. So no one said, oh, that was terrible, we're not going to do it again. They've all been there to say, yeah, this was important to us. It really changed how we do our work. And you can see I actually put this slide together last week where we started 10 years ago with 10 communities. And now, even since I updated this, we have 650 communities that have enrolled in the network. Plus, in 2017, we opened it up to states as well. So we have 9 states enrolled, 1 territory, and we've got another dozen states that are exploring taking this on from their leadership. And when we look at those 650 communities, just the communities, not the states, that represents 1/3 of the US population lives in a community enrolled in this network. And initially, the response was, oh, this is only for big communities. Well, it works in New York City, it works in Los Angeles, it works in Georgia, but it also works in Hart's location, New Hampshire, which has a population less than 100. We're now finding it works in unincorporated areas that have small populations where essentially you go door to door to do the survey. But this process works for communities of all sizes. So I think that's the exciting thing. And almost half of our network is communities under a population of 25,000. And it works rural, urban, suburban. But I did want to spend time not necessarily talking about the network, but talking about what we've learned. I mean, this is an opportunity to share, talk about where we're seeing innovation, where the opportunities are. So I thought I would do that by going through the different domains. So one of the big areas we've seen, particularly coming up, the last 10 years or so, is called missing middle housing. For us, we've got subsidized housing, which is government subsidies, and then you've got self-pay on the other end of the spectrum, but people in the middle really can't afford housing. They're not eligible for subsidies, they can't afford the self-pay, and a lot of this had to do with our own zoning and regulations. You have to have a 1/4 acre lot. You're not allowed to, have an accessory dwelling unit on that, So a lot of housing in this area is really looking at what we've done over the last several decades to suburbanize America and make sure, people have big lots and a lot of grass. And we've really pushed away from density. So what we want to do is allow for duplexes and triplexes and, a variety of other things. And then, as Stephanie mentioned, COVID really highlighted a lot of things for us. And big thing was inequities. And there's always been some housing instability out there, but now that it became more mainstream because people were losing their jobs, they couldn't go to work, they couldn't pay their rent. And then because there was a lack of supplies, the housing stock in the new housing market, those went through the roof. So what wasn't affordable before is now completely out of reach. So again, communities and states are trying to grapple with this, with rent protections. And for us, an eviction moratoriums, but a lot of rent protections and mortgage protections and those things are done at the local level. So you can have one community who says, yes, we've got a really balanced renters' rights in our local ordinances. And then you can have a community down the road that is like, yes, we are landlord focused. So there's not even continuity across the country, across the states, in terms of what we have in terms of protection. So I think COVID has highlighted this. There's a lot of folks who are having this discussion who haven't had it in the past because it was never a big enough issue. But now that has impacted people's friends and people who are middle class, it's not just a lower income disadvantaged community situation. The other thing is accessibility. I'm glad Stephanie brought in the lifelong housing from out in Oregon. I always joke that I live in a Peter Pan house. My house is designed for people who will never grow old, okay? There's laundries in the basement, bedrooms are upstairs, bathrooms are this wide. My house is 90 years old. And they never thought about building a house for people to age in. So my home will actually make a decision for me at some point whether I can stay here or not. As much as we're trying to renovate and get things to work for us, there will come a time where my house will say, nope, you're no longer fit to live here, and I'll have to go figure it out. So why are we building homes the way we used to? Why not build accessible, visitable homes? And next week, we're actually, one of the things we do in the network is we host a monthly webinar series. So next week's webinar is actually on housing, and we have a community from California that just passed a visitability regulation that that ordinance will now require future building to really think about this, whether it's publicly funded or privately funded. This is what we want for our community. So actually getting municipal leaders to stand up to developers to say, yes, if you're going to do this, we require this. This is what we want. And there's so many communities that are afraid if they stand up to a developer, they won't develop in their community. So, you know, there's, like I said, a lot of conversations going on around housing. The other thing is transportation. And I think one of the exciting things is we've shifted from thinking about vehicles to people. So we're going from transportation and a vehicle to thinking about mobility management. How do we move people in our community versus how do we move vehicles? And we're starting to see a lot more coordination. So you may have 5, 10, 15 agencies that are working together to move people versus competing with each other. If I'm going to take someone for a ride, how can I do that? How can we coordinate that so we can move the most amount of people, but still make sure that it's working? And it's not just to doctor's appointments, but it's also to social events and engaging people in the community. And then driver and pedestrian safety. Every year in the United States, we have a report that comes out called Dangerous by Design. And it highlights the worst communities in every state across the country to try to almost shame them into making improvements on intersections. And, so we have communities joining Vision Zero. We have communities that are working on complete streets. And, and then also thinking about what does transportation look like in terms of transit-oriented design? Are we just building things and not thinking about how people can get to and from? There's a community out west that's just opening up. I think it may have just opened up or is opening up soon. It's a car-free community. And everything you need, it's brand new. Everything you need will be within a 15-minute walk. And you can own places, you can rent places. Comparatively, the rents seem pretty reasonable compared to what rents are across the country. And then a big focus towards micromobility as we think about ways to shift away from a car-centered community, or we're have communities having bike share programs, scooter share programs, and ways that they can do that, but also make sure they don't just work in higher income neighborhoods, but they work in all communities across the country as well. Let's see. Outdoor spaces. Again, this is, COVID highlighted here. What's accessible in your community? Are things available for people of all ages? Like Stephanie mentioned about the very few number of older folks who are engaged in their local parks. And are they accessible? Can people get to and from once they get to the park? Is it accessible for people of all abilities? And what type of improvements they can do? As part of AARP's 60th anniversary, we went out and put what we call a fit lot, which is an adult fitness center. In every state in the country, we put at least one fit lot park that included a year's worth of programming for adults and older adults. So it would be exercise equipment that was there, a way to re-engage people in a different way within the park. We also are a big fan of sort of trying things out, doing tactical urbanism or pop-ups. So we have a pop-up placemaking guide where you can go and you can try traffic calming in your community to see if how that works. You can let people experience this in a temporary way before you go all in and say, yes, we've decided this for you. So again, trying to figure out how to do this and realizing that every community is unique in how they do that. Stephanie mentioned the engagement guide. We also did a national workshop in the fall, engaging older adults, and you can find links on here to the different videos, the keynotes, really talking about building trust, making sure you're engaging and truly listening to how things are going on. A lot of work going on, which is exciting in the Age Friendly Network on volunteer coordination, engaging people. So it's not just one church who has volunteers who help out or one hospital, but really thinking on a broader scale of what is it that people can and should be doing, and how can we ask? You know, one of the reasons most people don't volunteer is because no one asked. But thinking about, you know, what that looks like. Is it a long-term volunteer commitment? Is it something I can do when I need? And then also on this piece, we're looking at the value of older workers. So AARP in general, we have a whole department that works on the value of older workers. And one of the things we have is a older worker pledge program for companies to sign on to say, yes, we understand. We're not looking at older workers to say, oh my gosh, they probably don't understand technology, they're so antiquated. But to think about older workers, and when we talk about older workers, we're talking people 45 plus, starting to put the value of that institutional knowledge and that experience and everything, and thinking about what that could and should be. And then health and community services. In my breakout group, it was interesting hearing folks talk about what it is that they're doing and the integration within HMOs and the health system, and trying to use technology. And I think for us, this is a huge area for entrepreneurship. COVID, you know, we had telehealth and telemedicine prior to COVID, but it was fighting for every aspect of that. COVID opened up the doors to have this become more mainstream and more available. And as such, now that it is supported by the insurance companies, by our national Medicare for older adults and Medicaid insurance for people who are lower income, huge opportunities for technology and advancements and entrepreneurship to come in. So this is, like I said, really still in its infancy in this country, but it is moving because it now has approval. So that is one of the few good things that came out of COVID, is sort of a broader understanding, a lot of focus on improving health outcomes, you know, promoting engagement, you know, reduction of falls, reduction in diabetes rates, improved wellness opportunities, but also getting, I think the cool thing for me with Age Friendly is 5-6 years ago, if you would ask me about health providers being involved with Age Friendly, I would have said it's very low. We've had a huge shift in this country that now the healthcare providers are thinking outside of their bottom line to say, yes, if we engage with all these other community providers and supports, that's where health happens. And making sure people can get out of their home, they can get to their doctors, they can get to their prescriptions, they're eating healthy. And then, you know, lastly, you can't have people healthy if you don't take care of your caregivers. If your caregivers aren't healthy, then, you know, then that affects the health of other folks. There's a lot of work in figuring out how to better support caregivers. Communication information, a big focus, as Stephanie mentioned, on the digital divide, making sure people have access to broadband, people of all ages, increasing access to information. So we are, you know, we have a guidebook we created on how to do a community listening session. Actually, amazing how many people don't know how to listen to the folks who are in their own communities, and including the voice throughout. And I think the one thing through Age Friendly. So many times we want to tell people, we want to just push messages out. We have to be ready to listen. And technology is really coming in here too. We have communities that have apps that allow you to, if you see a pothole or something wrong in the street, you could take a picture of it and the app automatically sends it to the Department of Public Works or Transportation or whatever, fix that. Boston did a great job on, they have their subway app or their transit app that will get you from where you're walking to where you want to walk to exactly in step-by-step process. And again, exciting thing in Boston, you may not understand this until you can't find one, but they have a public restroom app. So things you wouldn't necessarily think about until you need it, but there's a lot of technology coming out in terms of listening, finding what's going on. Walk audit toolkit, there's folks who are doing apps to do walk audits for communities as well. And again, thinking about COVID, previously, if you were working on isolation and having that conversation, people were like, oh, that's homebound isolated seniors. Since COVID and people had to stay in, everybody understands what isolation is. So there's a broader understanding about what it means not to be able to go out of your house, to be fearful about what happens when you're looking at doing things. So we are seeing a lot of communities take advantage of this time to say, yes, we can get funding for projects we couldn't get in the past. We can have discussions because this is fresh in everybody's mind that we can and should address isolation because you know what it means. And no one in this point in time is going to say no. No, we want to keep them isolated. So that lifelong learning, making sure those opportunities are out for folks. And again, understanding who lives in your community. As I mentioned, respect and social inclusion, ageism is a huge, huge issue in this country. I'm sure, possibly in other countries, that how we view older adults. AARP has a program we call Disrupt Aging, where we do try to change that dialogue. But for Age Friendly, we see a lot of communities including an aging lens into their community plan. So they're not just saying, yes, this is our transportation plan, but we're also going to put a lens to our older riders or our older park users or whoever it may be. And I pulled out two examples here, both from Massachusetts. We have a lot of communities that are working on age and dementia friendly and working on those together, which are two distinct programs. But then one of my favorite things came out of Boston. They had their Department of Elder Affairs and they changed it to Age Strong Boston. So they actually changed their own language, created this great campaign about the power of people as they age, and really have been doing a lot of great work on overcoming those misconceptions. We also, a couple years ago, one of the things we heard a lot from communities was, if only I had seed money, if only I could get this project started, if only. So our department started what we call the AARP Community Challenge Grant. 5 years ago, we just closed it for this year, and all the grantees, I think we had about 3,400 folks apply. And prior to this year, we've awarded $9.3 million through 804 grants in over 600 communities with a reach of over 108 million impact on this. And you can see here, these are the topics that we fund: public spaces, transportation, housing, diversity, equity, inclusion. We have a lot of federal funding coming out in response to COVID. So we're trying to make sure that there's an aging lens put into that money as they spend it. Civic engagement, and then we do allow for other, but these are projects that can be done in 120 days. That can get you started. These are not long terms. These are like, what are those quick start projects that you want to and could and should do? And then again, as Stephanie did, here's some resources. I do suggest the second bullet, which is the Livable Communities newsletter. It is sort of a combination of a digest and a newsletter, and and it comes out weekly, and it's sort of the latest and greatest of what's going on across the country. So thank you.
Bill, thank you very much for a wealth of information, and I'm sure there is more behind it, of course, but we limit you as well, so I apologize. We had a few questions. We have some questions that we need 1 or 2 seminars just to answer them, so we'll just go with a few now, and I'm sure that later we can relate to other questions and in writing or in the on our forum. So bear with me. So just a few short questions, and if Stephanie and Bill can relate to them. So Ronan is asking, do states or municipalities see these impressive guidelines as binding? Are they just recommendations? What are they?
So for our community level work or state level work, that's actually coming through policy and through advocacy. Those are set in place. We do have, we have a combination depending on what community you go to. New York City has guidelines for landlords in terms of aging residents and public spaces and how to do that. Those are just sort of guidelines that are out. But like I talked about that community in California, that's an actual ordinance moving forward now on visitability. So it's going to depend on location as to how much strength that has, whether it's a recommendation or an actual ordinance or law.
Great. Yael is asking, can you address the impact of the COVID-19 on your activities? Whether you developed special services in response to it, and what are they?
So a couple of things. We do an annual survey of our member communities each year. One of the things we saw right away in 2020 was a lot of the people that were leading the age-friendly work got pulled away to specifically focus on COVID. But they told us a lot over the last 2 years. Communities that were in the network said they were better prepared to respond to COVID because people knew who they were in the community. They had already set up a partner network of both traditional and non-traditional partners, and they were able to adapt and pivot. But we did see a big shift. In 2019, the biggest things people were working on were housing, transportation, and outdoor spaces. In 2020, it was access to food. It was isolation and communication. So there was a big national shift on what people had to do. And like I said, what we heard from communities was they were ready for that. So we worked to collect and connect. We hosted webinars to share how people were doing this. We worked with the National Mayors Association to collect information. So it was really a lot of work on how people were adapting and how they were responding, so every community didn't have to recreate the wheel.
I got it. Liat is asking, can AARP allow access to their databases for research purposes? And I know there are a lot of databases, but just to hear the...
So this is a tricky one. So depending on what you ask for, yes or no. So we actually are just launching a collaborative of academic researchers from across the United States that focus on age-friendly. So we're having them help us do our survey. We're providing access out to the network. And we just created a new system now that we've sort of hit a sort of a tipping point in the number of action plans. We've got close to 300 action plans that have been submitted. We created a whole new coding system that we're going to be doing analysis on. So like I said, we're just looking at this and working within our communities, you know, in the United States, but we do, and I think Stephanie can talk a little bit more about that. We have talked about expanding that collaborative.
Right. So another facet of the question, Dr. Rona Dani is asking whether there's a way to run surveys, right, among your members.
So yeah, so we do. Go ahead.
Okay.
We do a lot of survey membership, of membership survey work all the time, but not necessarily through the age-friendly program. We just do, larger, broader surveys on all kinds of issues that our internal colleagues need to find out information from our membership on. In the age-friendly space, the surveys are more part of the livable communities or the age-friendly assessment that would be, sometimes they use survey instruments in that place. I don't know if there was something else that you wanted to say, Bill, on that.
I just want to add, so one of the things we did learning through the network was for a lot of smaller communities, it was tough for them to do a survey. So we created a survey. We now offer it to every community that joins the network, whether they're just joining or finished their 5 years and want to do another survey. So you meet with our researchers, we set up the geography of what and who you want to survey, and then we provide you with the link in a hard copy. So it's up to the community to distribute the survey, and then we provide every community with a report of their results so they have access to that. So again, one of the perks of being a member in the network.
And Bill, and we were talking also about, because like I said, we're doing a lot of work with Latin America about whether there's some way to, take our survey and translate it and utilize it, because there's another question I think Ron Dani followed up with, can we collaborate and have a custom survey? It was a special survey that was developed, and it's a platform. Bill can talk a little more maybe about that. So I'm not sure what the best way would be to see how we could help for the group in Israel to understand what that survey should contain and how it's done technically.
Our survey, everything we've talked about today is out there. It's free. It's available. You can actually find our survey on the website. You can take it, because there are communities who say, yeah, we want to change it. We're like, great, here's the survey. They go take it, adapt it, put it into SurveyMonkey. So we don't say this is the only way to do it. It's you can take the survey we've created that we update, or you can go ahead and access that. And again, if you do a quick internet search for AARP age-friendly survey, it'll take you right to it. You can
I got it. I see.
You can download it.
Right. Thank you, Bill. I see that Ron has a couple of follow-ups questions on the same area. So I suggest that I'm just hinting that Stephanie is a member in the Aging AL community. So just SMS through the platform or email her to continue the conversation around surveys. We have a couple of minutes for a question or two that weren't mentioned so far, if anyone has them and want to share.
I just want to respond to one of the questions about loneliness.
Yeah.
One of the links I put in, New York State just put out a couple of weeks ago a guide for community organizations to create their own friendly caller program. And it's got everything that you could need to take you through the process, so communities don't have to reinstitute that. And then again, the same thing that I have a link for with what they created in Massachusetts to encourage both age and dementia friendly work in the community simultaneously, and how to go about and make that work happen.
Great. So many thanks to Stephanie and Bill for agreeing to host today's meeting and share with us their insights and examples. As I said, it's a very short time, but it's a start. It was very fascinating. I urge everybody else, Stephanie and Bill, I'm just switching to Hebrew, אז אני מעודד את כולכם באמת להיכנס לפלטפורמה, להמשיך את השיח עם סטפני, חברת קהילה, ביל, אנחנו תכף נצרף אותו, ואפשר להמשיך את השיח איתם גם שם. אני חושב שזה יכולה להיות הזדמנות מצוינת להתחבר לארגון שהוא באמת ארגון יוצא דופן בכל קנה מידה, ורוצה באמת להודות לכם, לכל מי שהגיע והשתתף במפגש. ההקלטה תועלה לקהילה הדיגיטלית בימים הקרובים. מזמינים אתכם להמשיך ולעקוב אחרי האירועים שלנו והפרסומים שלנו, ולהצטרף לקהילה הדיגיטלית, שבטח לירון, מנהלת הקהילה הדיגיטלית, תעלה או העלתה את הקישור אליו. ורוצה להודות כמובן ג'ואנה ולירון, שמובילות את כל המיזם המרתק הזה.
ותודה לאופיר על ההנחיה והליווי פה בכל הסשן של השאלות.
תודה אופיר, תודה ג'ואנה. Thank you very much Stephanie and Bill, it was fascinating. תודה לכל חברי הקהילה שהגיעו, והם מוזמנים להמשיך לעקוב אחרינו. אני רואה שיוסי רוצה פה להגיד מילה, אז יוסי, הבמה שלך.
Thank you. Bill and Stephanie, thank you very much. And tomorrow we continue our conversation, so we'll meet you tomorrow. להגיד לקהילה, רק לעדכן אתכם, אנחנו בקשר ביחס למהלך שאנחנו מובילים של רשות מקדמת הזדקנות מיטבית, או מיוני 100, ומחר אנחנו נמשיך את השיח עם AARP בנושא הזה. רק לעדכן אתכם שבשבוע שעבר הוועד המנהל שלנו אישר לנו לצאת לשלב ב', היות והקהילה הייתה מאוד מעורבת, עדיין מעורבת במהלך הזה, אז המשמעות היא שב-29 באפריל, בעוד 3 שבועות, יום אחרי חופשת הפסח, אנחנו מפיצים את הקול הקורא, אנחנו נצא לשנת תכנון ברשויות המקומיות, אנחנו בימים האלה עוברים על קול קורא אחר, קיבלנו כבר תשובות למתכננים, מתכנני ערים, פיזיים חברתיים, אנחנו נצמיד לכל רשות שתזכה ביוני, מתוך ה-20 רשויות בלהיכנס לפיילוט, או יותר נכון בטה סייט של המהלך, אנחנו נצמיד לכל אחד מזה מתכנן, שאנחנו נדריך אותם ונעבוד על בסיס מפת מדדים משותפת, אבל תוכניות שונות שיבנו בכל רשות מקומית. יהיו כנראה בתהליך הזה 7 רשויות מקומיות גדולות, או ערים גדולות, מ-250,000 ומעלה, יש 11 כאלו בישראל, 5 בינוניות, 150 עד 250,000, 3 קטנות, 2 ערים ערביות, 3 אשכולות סלש מועצות אזוריות, רק ה-11 אשכולות היום מכילות למעלה מ-100 רשויות בישראל. זהו, אנחנו 40% מהרשויות שיבחרו יהיה ברמה סוציו-אקונומית 5 ומטה, אז שתדעו שיצא קול קורא, 5 ימים אחרי זה, למי שירצה להשתתף וקשור לרשויות, יהיה אפשרות לרשויות או לאחרים לשאול שאלות לגבי הקול הקורא, ואני מקווה, אנחנו נעדכן אתכם בקול הקורא, יכול להיות שכדאי להפיץ לכם אותו אפילו, כדי שתראו לאיזו אזורים הוא לוקח עוד פעם, ואחר כך כשיבחרו הרשויות, אנחנו נפרסם לכם את זה, וייתכן שיהיה לכם ערך או רצון להתחבר לרשות כזו או אחרת, אולי אפילו ברמה ארצית. אז אופיר, ג'ואנה, אמיר וכל שאר החברים, רן, שמובילים את המפגש הזה, אז תודה רבה, ושיהיה לכולם ערב נעים.
תודה יוסי.
תודה רבה.
תודה רבה.
תודה לכם. להתראות.
כן, יהודית, אנחנו נפיץ, כמו שיוסי הציע, בהחלט נפיץ את הקול הקורא.
כן.
תודה, תודה. מעולה. אוקיי. טוב. אוקיי, זה אנחנו.